when I advise startup companies and early stage companies, I always say, who's your competition? Everybody says nobody. I'm like, bullshit. Okay. That is not the case. So we have competition. However, the competition is not doing what we do the way that we do it. And they're also leaning heavily on AI. And AI is a great back end tool for what we do, and we use it extensively, but it's not a diagnostic tool.
Good morning. This is Wally Darling with the Darling Difference podcast. And this morning I had the pleasure of speaking with James Keppel. He's out of Fort Collins and has a company called Serrana Health. And so without further ado, I'm going to turn it over to James and he'll kick it off and tell us a little bit about his background and his company.
Hey, Wally, thanks for having me. It's rare that anybody asks to record my ramblings on purpose, but we'll give it a shot here. Um, let's see, history of the company. I actually was in the design business for 20 years in the San Francisco Bay Area, and I decided to sell off my firm and go do something different. And at the same time, I was having a personal health issue where I needed an organ transplant. And so I got thrown into the grinder of the legacy healthcare system and really just saw all the problems, and they weren't really solving anything. They were just sort of managing at that point. So I basically developed the Serrana Health program around my needs and the way that I wanted to be treated as a client. And, I wanted people that paid attention to me and that sort of thing. And the result after a few years was I don't need the organ transplant anymore. My existing organ function is up by about 40%. And I have to take some limited medications, but they're not forever. And they're just, more maintenance sorts of things. So anyway, going through all that, I just saw all the failings of the legacy healthcare system, and I decided to do something about it because my nature is to fix things. So if I'm ever walking down the hall in your office and there's a picture that's crooked on the wall, I'll be the guy who straightens it for you. So,
And I would probably walk right by it.
right, right. So, yeah, that was really the genesis of the company. And then we've been around for a few years now, building out the team, building out the science behind what we do, because this is not just a sort of feel good thing. It's very science and physiology based. And, we've gotten very good responses. The thing that people like the most is the one-on-one interactions with our team, and they feel like they're actually talking to somebody, and they get some time, and they can ask questions and all that sort of thing, which is just totally gone from the legacy healthcare system because doctors are trying to see 20, 30, 40 patients a day. They get about 10 minutes in the room. They don't really have any prep time, all that sort of thing. So what you're getting is just Band-Aids, basically. You're masking the problems, whereas we get to the underlying cause and figure out why you have a problem, or in an even better situation, how do you prevent ever having a problem?
Wow. It's kind of a small world out there. I'm actually in my fourth month after a transplant. And, it's something that crept up. I used to be an Army officer and I had a command on the Korean border. And I contracted something almost 35 years ago that was dormant in my system. And all of a sudden it attacked about 2 years ago. And, you know, I, I'd probably never done much more than taken aspirin before that. And then all of a sudden it was life threatening. And my prognosis was less than 5 years. And um, I got a transplant in August of this year. And it really kind of moving forward from that, kind of feel like I've got a new lease on life. But I've certainly experienced what you're talking about in terms of the last 2 years. The biggest thing I noticed was the coordination of care between all the different, hospitals, facilities, doctors, specialists, whatever. There always seemed to be a crack. and information just fell through. And if I, or my wife wasn't on top of it, sometimes, things would go unnoticed or missed. So,
It's interesting that you bring that up because we've got a presentation that I give to small groups, and one of the things that I identify there in the problems with the legacy healthcare system is the lack of coordination. And you hit it right on the head. I mean, the right hand doesn't know what the left hand is doing, and I had some just absolutely insane uh, diagnoses and suggestions on treatment. And I'm not a doctor, but I knew that that was the wrong way to go, and I turned out to be right.
yeah, I mean, I tell people all the time, I'm not a doctor, but I am, I think, fairly intelligent, and educated. And when it doesn't pass the smell test, I call it, I raise my hand and say, wait a minute, what about this? And it's the same with any profession. I've had the same situation over my lifetime with lawyers, that you know, they may be good at some area, but they don't know what they're talking about in a lot of areas. And so you got to be your own advocate. I've found.
Right. Well, you hit it right on the head. In that, I feel like the way that the healthcare system in the U.S. has become, it's you are in charge of managing your care. Your care team is not, and that is completely backwards. I mean, you don't go to the garage to get your car repaired and they hand you the tools. It's like you go there because there's expertise and you need the benefit of that expertise, and that kind of stuff is just evaporating. It's
Yeah, and
unfortunate, but
one of the parallels for me is, I do wealth management and retirement planning and stuff, and my clients expect me to be proactive and looking at market conditions. They're not looking for me to just set up a plan and forget about it, which is unfortunately the biggest paradigm in most of the big box firms out there. Is they put you in a box of conservative or whatever, and they forget about you until you scream.
yeah.
You know.
Well, I love the word process because, yeah, people say, well, what's your process? We don't have a process because everybody is different. What we have is a framework that we work under, and that is that, the client goes through this journey. There are these steps or these milestones, but the way that you get through that framework is completely different for everybody. And that is, again, where the legacy healthcare system is just failing. They don't treat you like a person. You're a number on a spreadsheet. And it's just I think it's immoral, number one, but it's just not what we should expect, being the wealthiest country in the world, and we have one of the worst we have the worst healthcare system in the world, according to many surveys that have been done. And we have the highest rate of chronic disease. We have, just I could give you 20 stats of things that we're terrible at, and it makes no sense.
And then you add the layer of insurance on top of it and pre-authorizations and all that kind of stuff, and before you know it, it's a full-time job just to manage your care
Yeah.
yourself.
Well, why is somebody behind a desk in Buffalo deciding what my treatment is? My doctor should be working with me to determine what my treatment is. It shouldn't come from somebody who's looking at basically a script for, how do you handle this? And they read off the script. And if you don't fit in that script, it's too bad. There's one medication that I have to take right now, and who knows how long I'll have to take it, but there's only one manufacturer. There's no generic. And when it first came out, it was $8,000 a month.
Yeah.
I think it's now down to like $2,500 a month. And and there's no substitute. So every time that the pre-authorization came up from the insurance company, they'd say, well, we don't cover that. I'm like, okay, well, your options are I can die. And by the way, I'm recording this phone call, or, or, you can get me the medicine, and they wouldn't do it. So, and then, years later, after finally getting them to give it to me, a couple years later, they just decide we don't cover that at all, period, for
Wow.
anybody ever. And I'm like, okay, what do I do? You know, what? I'm not the doctor here. Give me an alternative. And every doctor I talk to says there is no alternative.
Yeah.
So, you know,
Yep,
just
absolutely.
good
And
luck.
and then I always love, not get too much off the tangent here, but the other uses of medications like, what is it, the big Ozempic, for weight loss these days. It's like, I don't think that's what that was designed for, but
It was, and it's a happy coincidence. Just like Viagra. Viagra wasn't developed for what it what it turned out
Yeah,
to be. It turned out to
exactly.
be a money machine, but it's not. But I one thing I want to make very clear here is I go on all day about what's wrong. We're all about where the future is, and you can say like the future is now, but the future really is now because the healthcare system has absolutely failed, and somebody has to do something about it, and I'm hoping to do our part to get to, more than anything, raise awareness that there are other ways to do things, are better ways to do things. There are things that react to you as opposed to a spreadsheet or a geographical survey of a certain area. There's just a lot that we should be thinking about, and most importantly is what we should be thinking about is prevention, because you might have heard the term medicine 3.0 that's sort of bouncing around right now. That's all about prevention, and that's
Yeah,
where we are. We can handle chronic diseases, and we do, and we can take people who just have concerns that they don't have any, they might have a family history or something, and we can get them on the right path. But day-to-day prevention is really the way to go, and that's done in some very basic ways. Just watch what you eat, and you have to make some behavioral and lifestyle changes. You have to get a lot of sleep, and you have to be on some sort of a course to maintain your health. And you also have to know that you don't take a pill and suddenly you've reached optimal wellness.
yeah,
It's an iterative process. Every time that I do my checkups, we change something because, one level went down, we wanted it to go up. So now we have to figure out, okay, what's affecting it? Why does it go down? And, when you look at the interconnectivity of all the parts of how everything in your body works together, it's a very different approach to putting a Band-Aid on everything.
yeah. And I've pushed back quite a bit myself because you're right. They'll do a test, and then all of a sudden they want to add another pill or whatever it is, a treatment, and I'm like, wait a minute. I don't think 2 weeks time frame is enough. Let's spread this out a little bit before we make an additional, because otherwise we're just playing back and forth this yo-yo. And so what does a typical day look like in your business for you?
For me personally,
Yeah.
well, first I have to vacuum the floor of the office. And uh, we're an early stage company, so it's kind of all hands on deck. Everybody does everything.
Uh-huh.
Because of just the nature of being the founder and the CEO, I've got to have my fingers in everything. And that's where building the right team behind you is, or next to you, is really incredibly important, because one person can't do it all. And we're trying to slay a 900-pound gorilla here. We're not going after something small.
Yeah. So, about how many employees do you have now that work
We
on
have
your team?
9 we have 9 right now, and, most of them are care providers. We're very low on the admin side, very low on our overhead, and, again, early stage companies, that's just the way you have to approach things. This is my 4th startup, so I've been around the block on this one.
Exactly. And so right now, do you see this type of approach gaining more traction
Yeah.
in the future?
Yeah, it's absolutely everywhere right now, and, we people, when I advise startup companies and early stage companies, I always say, "Who's your competition?" Everybody says nobody. I'm like, bullshit. Okay. Okay. That is not the case. So we have competition. However, the competition is not doing what we do the way that we do it. And they're also leaning heavily on AI. And
Uh-huh.
AI is a great back end tool for what we do, and we use it extensively, but it's not a diagnostic tool. And a lot of times what you're getting is you get your lab test done, it goes into the AI machine, and it comes out and a doctor probably looks at it or whatever, but after that it's like, here you go, and that's what it told us. But again, it's missing all the personalization because it's taking wide swaths of the population and trying to make them all fit into one box, and they don't.
So, what would you say, I mean, is your business, um, plagued by, regulations and, taxes and costs and all that kind of stuff? Or, is that a big challenge for you?
Taxes and costs, of course, are for everybody, but we don't have major regulatory hurdles other than for some of our programs we offer one-on-one treatment from your physician, and in others it all works through the coaches, which gives us more flexibility. So when you go for the physician program, we're limited to medical licensing in the state where the person is. And medical licensing is another thing that I'll take on someday. But,
Yeah.
there's no national medical licensing. So Texas does it one way, California does it another way, Florida does it a different way, and Colorado does it a different way. And so you have to chase that. So that's number one. Number two is first thing that everybody asks us is, do you take insurance? And the answer is no, we can't, because most of the stuff that we do is not covered by insurance. And that's not because it isn't proven science. It's just because they've decided not to cover it. And I did an experiment one time where I went to get my testing panels done and I priced it out and I went to some of the big lab companies and I ran all over the place. I spent 9 hours and I saved about $15 on the testing. It was a complete waste of time. So, another benefit working with us is it's all in one. You get everything all in one place. You pay one fee. It's every month. No surprises. We do have specialized testing for specialized uh, conditions, but in general, our basic panel is what's included, and it'll cover most of. It was designed to cover most people who walk in the door.
Now, do you market directly to consumers, or is it more of a relationship with medical professionals?
We stay away from medical professionals because they want to contradict us and tell us that we don't know what we're doing. Because, you know, um, there's egos at play and all that sort of thing. But so we don't market there. We do have a direct to consumer product, and we have a what we call our Teams product, which is meant for corporate environments. And it's your typical corporate wellness program is exercise and eat this, right? Or do yoga or whatever, which is fine, but it's not a treatment necessarily. It's a practice. Um, so on our corporate side, basically, the 2 products are exactly the same. We just market them differently, and there's a longer sales cycle, and we price them differently depending on volume.
So on the corporate side, are you going into like, because I know based on the nature of some of the businesses, they're kind of what I call self-insured plans, where they're not going to Blue Cross or United Healthcare or whatever. They're saying, hey, we're going to manage this cost instead of having to pay all these premiums and all that kind of stuff. So are you approaching those types of arrangements?
Yeah, what I'd like to see would be that, um, people get when they get an employment, offer, a lot of times they get basically this sort of list of services that they can take as part of their benefit package. Some people might want childcare, some people want wellness, so, whatever. Um, so I would hope that we would be offered as an employee benefit because number one, it's a value for the business. The return on investment across the board for companies of 200 or more who have a wellness program of any kind, they get a 15% cost savings right off the bat across, and that is top line. Okay. So there's a benefit to the business. There's obviously a benefit to the employees, and they not only are taking care of themselves, but they're better workers because they're healthy and they're not missing days and, all that kind of stuff. So, I'd like to see it offered as an employee benefit. However, companies are going to structure it differently. They might say we offer it, but the employee has to pay for it, or we pay for half of it, or, it's just like health insurance, same kind of negotiation.
Yeah, in my past, I mean, I've been doing this for a long time. At sometimes I offered some health insurance supplements type
Hmm.
stuff, and some employers would be willing to participate in that, and some weren't in terms of offering it. Oftentimes, it was offered, but it was at the expense of the employee. And so, and I'll just throw out one company like an Aflac. You know, for people that really understand the cost of having health insurance in this country, oftentimes, yeah, the doctor got paid, the hospital, or whatever, but how about all the other stuff? And so those supplemental insurances, certainly help to offset. And so it was a very viable platform,
Yeah,
and
and with premiums going where they're going in a couple of weeks, I mean, or 3
yeah,
weeks, it's gonna be
yeah, I
an
just got I don't know, a 200% increase, almost it seemed like, but good news is I've only got 8 months this year, coming year till I'm 65, so, you know.
and then you're on the, Medicare train until they take that away from you, right?
Yeah, exactly.
Again, I just think that the approach in the US to healthcare is just it's really, see, a kind word would be immoral, but,
Yeah,
it's not, it doesn't have any respect for people. And if you talk about, I'm not going into politics here, but if you talk about what governments are supposed to do, kind of fits right in. You know, we maintain roads. Why aren't we maintaining people?
yeah, and, that's there again, in my business, I also am always kinda agnostic to politics because you never know, I don't wanna have a relationship sour because they don't think I'm liberal enough or conservative enough or whatever. I'm pretty middle of the road, but at the same time, you gotta look at these problems and you say, um, government sometimes can't, at the level they're at, can't really solve the problem at the user level. And, they can throw money at it, but the more money they throw at it, seems like it brings on the fraud, you
Yeah, and
know?
I'm very different than the approach that you just put out there, in that I'll talk all day long to anybody who'll listen what's wrong and how to fix it. And somebody's got to do it, right? So if you don't like my politics, then I can't help you. But
Yeah,
that's the way I feel, and I'm not going to hide that, because I think that what we're providing is a valuable service that should be there, and we're giving governments, we're giving companies, we're giving people a way to reasonably afford it, because we're kind of like concierge medicine, but not at concierge medicine prices. You're not going to get a good concierge doctor for $199 a month, right?
yeah,
So, uh, it's a valuable service that, I think people, once they're educated about the value and educated about the fact, as I mentioned earlier, that there is another way to get your health care, that we'll see, this, major inflection toward moving away from the legacy healthcare system. And I hope that we're just one of the companies out there. I would love to see somebody who would come up with a solution for health insurance,
yeah.
you know, and I keep looking to find somebody who's got something interesting. But when somebody takes that on, I'm going to be right next to them.
Yeah, I've seen in the past, and never participated, but I've seen, like, some religious groups have created their own little HMO, for lack of a better term,
Yep. Yeah.
and, you
Like
know,
health share
I
accounts. Yeah.
what's that?
Health share
Yeah,
accounts.
yeah,
Yeah.
and I always wondered, okay, that works well if everybody typically just has normal stuff, but when you start having a group within the group that's, having some real serious issues, and all of a sudden that system goes bankrupt.
Yeah. Yeah. And that's where we're working on a partnership with one group that provides that, but I've got the same questions that you have. You know, what happens when somebody needs $2 million worth of surgery or whatever? Another place that I'd love to see the insurance business go is toward offering catastrophic insurance because, you know, the day to day, you know, people go to the doctor every 6 months because they think they're supposed to or whatever. Maybe they have a small problem, they break something or whatever. That's very different than being in a car accident or having cancer or having a heart attack, you know, right? So why do we put them both in the same category, and why is each one funding the other one or taking away funding from the other one?
Yeah, I recently saw on TV where there's this doctor, and he's anyway, his company that he developed has this kind of like family health pack, and it's got, loaded with a bunch of different common types of prescriptions, and the diagnosis of what, and there's a helpline, but it basically prevents you from having to go into like an urgent care or emergency room or whatever for stuff that you can self diagnose and take care of it a whole lot more or less expensive.
Yeah, and if anybody thinks that the cost is gonna go down for the providers, they're out of their mind with the current situation
Well,
with
that's what I say about
subsidies.
taxes.
Well,
You
yeah,
know,
when the subsidies go away, what's gonna happen, mark my words here, millions and millions of people are not gonna be able to afford their health care. They're gonna go to the emergency room because that's the only place they can go, and the emergency room can't say no.
yeah,
Right? It's illegal to say no. Not that
yeah,
that matters anymore these days, but, um, so, you know, I think you're gonna see a shift. So, again, when I focus on what can happen in the future, I think it's important to identify what doesn't work so that you can come up with what does work. And what we've developed, we have the data, we know that it works. And I'm living proof because I'm still here
yeah.
because of the whole program itself.
Yeah, I mean, my last 2 years was probably $800,000, and if I hadn't had the insurance I had, then, it's a life-changing financial, situation, but, there again, I know the system is, got a lot of areas it needs to improve on because once I was in it, even though I had the card that said, "Hey, pay," um, there was quite a few opportunities for it to go awry, even though I was in this so-called medical system. You know,
Yeah. Well, and think about, this isn't a measure of intelligence or anything like that, but certain people can deal with certain situations and they like, I know that I feel like if I get in a situation with the doctor and I'm not hearing what I think I should be hearing, I will call them out on it. And of course, that ruins their 10 minutes at the appointment kind of thing. But it's important to be having those conversations so that you can move things forward. And uh, this idea that some people can manage this that other people can't. So think about somebody who can't manage it, somebody who is not used to fighting with people if they have to get what they need. They just say, okay, and go about their lives and they're not any better and they're not going to live any longer or whatever. They're putting there's a natural limit that we all have. And if you're not able to manage your own care right now, it's very difficult. So again, thinking about the future and how we move things forward in a modern way is we are having conversations with you all the time. We're reacting to the things that you're telling us. We're not just working off of a list of here's how you treat this. It's all very individualized and it's all very much about eliminating those barriers to getting good care and having to fight about stuff. I mean, I've had so many phone calls with companies about things. It's like you're telling me something that makes no sense. And here's why it doesn't make any sense. And they're reading off a script and they say, well, that's what it says here. And that's all I can do. So those are the
Well,
types of
that's
things
one of the
we
things
need
that
to
concerns
eliminate.
me about AI,
Yeah.
is that, you can get that script and it can be the wrong script and it's not really listening. It's just throwing out a bunch of information.
AI is only as good as what you ask it.
Right, exactly.
Back
So
I used to be a touring or semi-pro touring musician, and, whenever we record, we had a saying is like, "If you put garbage in, garbage comes out." You
yeah,
know, it's
but,
the same
hey, the
kind
garbage might sell,
of thing. Right. Well, that's a different discussion,
Yeah.
maybe.
Let me ask
But,
you,
you know.
so with 9 employees, the startup, or emerging company that you're developing here,
Mhm.
what if you had to pick one thing, what in your role as the founder, CEO, what's the one thing that really keeps you up at night?
Funding, basically. We're at this inflection point where we've proven that what we do is valuable. And, if you look at the investment world out there, it's not really friendly to the kind of things that we do because it's not the next Twitter or something. They're
Yeah.
looking for 10x return in 2 years. That doesn't happen in healthcare anywhere. So that's a big challenge. But I know that when we find the right person who understands what we're doing and wants to make an impact, kind of a change by through their investment, then we can take this to a different level, which I'd like to, because I never designed this company to be just a small thing that we do for a couple hundred people. It's meant to treat tens of thousands of people per year.
Yeah, so are your employees their employees or are they contractors?
We've got a mix of
Okay,
both. Yeah.
okay.
And that's this typical, how do you balance a startup, and you've got a certain amount of cash, and you just have to do the things you have to do. But that's very much outside the mission. And we don't I don't consider us to be a social impact company, but we are a social impact company when you get right down to it. And that impact is part of the mission, and that's what we all do every day. And my team has been great in that they know that this is a long-term thing. It's not, how do I make a bunch of money and get out of here? And hopefully we can take it to the next level. That's really what I'm looking for right now.
Absolutely. Yeah, and I'll send you a link to it, the podcast, some other people I've talked to, but, I've talked to other, people, on some of these podcasts, and it's been amazing. Some of them are, just like single homeopathic person. Okay, that's, an area. But then I've talked to people that have built over time, like, pretty amazing, imaging nationwide imaging, and turn it into a rather big business. So the path to get there, is a challenge.
Yeah,
Um,
but on the, just if you want to talk about the investment side of those types of things, it's a little bit, I won't say it's easy, but it's different, because if you've got a medical device, it's okay, we've got FDA approval. Here's what it does. Here's how much it costs. Buy it, put it in, and here's the result. If you've got a pharmaceutical or something in the life sciences world, forget about pharmaceuticals, so something in the life sciences world, again, we've got FDA approval, we've got clinical trials, and this is what it does, and here's the data, and that's a little bit easier. We're in the services business, and people, a lot of people don't see that the service is really the important part.
mhm.
When I started the company, I wanted to be a reference um, library, basically, on the latest research and latest information at all times on this integrated wellness approach. And then I realized that nobody's really doing it the way I want to see it done. So we just had to get into the business of doing it. And I still, you know, put a lot on the research side and the educational side, and we'll always continue to do that. But the delivery of the service is really the important part, because you've got people who are, They've got knowledge, they've got experience, they've got intuition, they've got judgment, they've got all these things that's the service. It's like, well, when I go to a lawyer, why does it cost me $600 an hour? It's not because it costs them $600 an hour to keep the lights on or pay the rent or anything like that. It's because they've got a skill that other people don't have. And that's the value that's been placed on it. So, that's a service business too. Don't-
Yeah,
when you think about it.
yeah.
So
And
that's one of the
don't
challenges.
get me started about lawyers. I mean, I've oftentimes said they're a necessary evil, you know?
Yeah, well, I gotta be careful. My girlfriend's father was a lawyer, so
Yeah, no, no, I understand.
I
I've got
always
lots of friends that are,
whenever
and
I'm talking with her, I say, I'm gonna bash a lawyer right now, but I'm not talking about your dad. He was a great guy.
now, well, if someone was going to reach out to you, how would they do that?
If you want to get to schedule a health talk, which is really the first step, it's a 30-minute free talk. It's not marketing. You're on the phone with a health coach, and they're basically learning about you at that from that point. So you're in the program for free for the first 30 minutes. So in order to find that, if you go to our website, which is Sarana.health, it's not Sarana.com, it's Sarana.health. And you'll see there's a number of opportunities to learn about what we do, how we do it, and to schedule your health talk. So that's the uh, first line of connection right there. If you want to get to me directly, it's James at Serrano.health, and I'm easy to find. So
Absolutely.
if you want to tell me how wrong I am or how right I am for or whatever,
Yeah, yeah.
I'm
You'll
available
show up on the late night comedy circuit, you know?
someday. That's what I wish I was doing, but
That's a whole new world. Well, I want to thank you for taking this time. I like talking to people, small business owners, and I basically talk to consumers and I talk to small business owners, and different, oftentimes different issues or things that they worry about. Consumers to me these days tend to want to due diligent to death, you know, because there's no trust in the world. And then, business owners typically it's like, okay, this makes sense. Let's do this, type of situation. So, but I really appreciate you taking the time, and I wish you well with your endeavors moving forward.